Good afternoon. Thank you for joining us here today. We are 5 months into our vaccination initiative here in San Diego County, and we have now officially surpassed 3 million doses being administered. We are seeing what I think is really tremendous progress in terms of the number of folks being vaccinated, the number of doses being administered, and the progress that we're making. And I think San Diegans should take a measure of pride in how far we've come. 63% of the eligible population of San Diego County residents have received at least their first dose. More than 44% have received their second dose. And those are all true things we should appreciate. Obviously, from the very beginning, the approach to vaccines was based on large superstations along with smaller pods. And the intense demand for each of those appointments in each of those spots. We spent most of the last 5 months talking about how difficult it was to get an appointment because of much greater demand than there was supply. Well, now the supply has caught up and the demand has diminished a little bit. We still continue to see high numbers of vaccines being taken every single day, but we now have to shift and adjust and pivot our approach as we administer vaccines to work to make them more convenient, to make them a little bit easier to get the folks very motivated who would drive anywhere in the county and click refresh on their website over and over and over again for hours on end. Those folks have pretty much all been vaccinated. And so a part of that shift is us now extending appointments 7 days out. We've been running about 2 to 3 days in advance. We're now extending it 7 days out so folks can plan a little further in advance. We're also shifting several of our sites to go until 8 p.m. And I will share with you in the slides, it's a location in Oceanside, Chula Vista, and El Cajon. Starting today, we'll be going until 8 p.m., or tomorrow, I believe. We'll be going until 8 p.m., and we're looking to extend others with different hours and configurations as well. And we're also shifting some resources and focus to setting up more pop-up, drop-in vaccination locations in high-traffic areas. We are working with MTS, for example, on identifying frequently high-visited areas where people, as they're moving through, might be willing to drop in and get a vaccine on their way home. We're working with senior centers, with faith-based organizations, the Elks Lodge. We're working with the Council on American Islamic Relations, looking at large gatherings and numbers of folks around the end of Ramadan. And we will have more information about partnerships for employers and businesses and way people can sign up to get on a list to have a pop-up or drop-in vaccine site brought to them in the coming days. We saw tremendous success in South Bay. Vice Chair Vargas led the effort in large part in partnership with the Otay Mesa Chamber of Commerce. They organized their members for 5 different events, over 10,000 people vaccinated, and we want to take that same model, apply it to other employers, work with other chambers, and show people how they can sign up, and we'll have details on that coming in the next few days. In terms of vaccine allotment, it's a steady stream. We're a little bit lower on the dosages this week. That was primarily the number sent to multi-county entities. What we got as a county entity remained about the same, but you'll see in the slides a little drop this week, but it's okay. We expect the numbers to increase next week. We're able to meet the need and continue to get out and work and continue to ramp up and push all of our various programs. Today's dashboard, you will see that jump up to 63% of folks received their first dose. Part of that is a jump. We did get the Department of Defense numbers, and we have been able to incorporate in their first dose and fully vaccinated numbers, along with the Veterans Administration. So those are now fully updated. We will be getting those updates from them every 2 weeks, and as we get them, we will add them into the dashboard so you can see that. And again, we want to express our appreciation to Congressman Scott Peters for him and his team for their willingness to work with the federal entities and partners to help us get access and insight into those data. It gives us a more complete picture of where we are in our county. With that, let's jump into our charts for today. Here you can see the 3 locations, vaccine clinic evening hours 1 to 8 p.m. Oceanside, you see there Sunday to Thursday, Chula Vista Sunday to Thursday, El Cajon Tuesday to Saturday. These will all be open from 1 p.m. Until 8 p.m. And again, we are looking, we're going to assess how successful these are and look at extending these hours in other places, try and make it a little bit more convenient for folks, maybe on their way home after a long day, have an opportunity to stop in and get vaccinated, and we'll continue to assess that. We're also going to be doing more vaccine events, more kind of mobile pop-up drop-in sites. I believe our next slide here will show us a few of those that are upcoming. And again, these will all be updated on our website. We're going to be adding, I think, considerably more of these. You see one at Southwest College, Palomar Family YMCA, the Elks Lodge, Northgate Market, Mira Mesa Senior Center, a couple partnerships with the Catholic Church, Sherman Heights Community Center, Mission San Luis Rey, and others. As I mentioned, we're also working with MTS, a number of other places. And so we think this is an opportunity where we can take a site into the community, into high traffic areas, and catch some more folks. Again, the aim just to make it a little bit more convenient, a little bit easier to get in and get access to a vaccine. Let's go to our next chart. Here again, you see the dashboard. We're down a little bit this week, but when you look at those charts, I mean, what you see right there is a little drop in multi-county entities and the federal numbers. Numbers coming to us as a county relatively stable, but you know, we expect there's going to be some ups and downs throughout, but we are still considerably higher than where we were, you know, 6 weeks ago, 8 weeks ago, and again, we're having plenty of supply to meet the demand as we shift and pivot our approach to providing vaccines. Next on our dashboard, what you see right there is the goal population. Again, that's where we are, almost 84% of the way towards hitting our goal with first doses. And then obviously on our dashboard, we also show the numbers just based on eligible population and how that is going. But again, more than 3 million doses administered, and very pleased with San Diegans and how we've done as a county in terms of reacting to this. Next one shows our case numbers. We continue to do well here. I mean, our percentage of positivity, our 14-day percentage of positivity, 1.4%, which is really, really good. You know, numbers are just plugging right along there, 100, 200, 150, right around there. You know, testing numbers going down, fewer people are getting tested. We remain, robust testing is available, but on the whole, we think that we are doing good. And then the final chart here is just the case rate chart. Again, you see us coming down almost a full point from last week, 6.4 to 5.5 unadjusted case rate, and adjusted case rate 6.2 to 5.0. Testing positivity percentage, again, this is a little bit of a lag, but we think this is good. You know, I would say I'm not optimistic that we're going to descend below the orange tier before June 15th. It would take 2 consecutive weeks of metrics in the yellow tier, and we have a little ways to go. But throughout the duration of this, we've had relatively low case rates compared to other counties, and we continue to do very well, and we know businesses are reopening and are getting back up and running, and so we feel very good with the direction we're headed and how San Diegans are responding at this point. We'll now hear from Vice Chair Vargas, and then we'll go to your questions. Both Dr. Wooten and Dr. Shaw are here to answer any questions.
Thank you, Chair Fletcher. I'd like to start today by thanking all of our teams from the county and partners in the community for all the hard work they continue to do. We would not be where we are today if it wasn't for all of your community participation and doing this together. So as we shift into a different approach to make sure that our vaccination goals are met in the whole county, I'd like to share some positive numbers in terms of vaccination. And Chair Fletcher has shared some of them, but I want to make sure we emphasize that the South region still has the highest percentage of vaccinated rates. As of May 5th, we have 67.2% of the population that actually has at least one dose of the vaccine. And the second one is the North Central region with 61.9%. And the reason why I share this is because I think it's important to note that our interventions are working. And so we're going to continue to ensure that we are focused in getting our communities out to get the vaccine. And it's also important to note that in 10 out of the 39 most impacted zip codes in San Diego County that were designated health equity zip codes, over 50% of the population now has at least one dose. In terms of demographics, which is the high Latino population in District 1, which was the one population that was greatly impacted by the pandemic, now the population has 60% of that population has actually been vaccinated. And so as we continue to shuffle resources in a creative manner so that we are able to reach these communities that are behind and ensure that there's equitable distribution of the vaccine across the county, We want to make sure that these numbers continue to increase, and we're going to do everything we can to make sure that we're delivering the vaccines. We can't lose sight of the importance of staying the course and making sure that those that have not had access to the vaccine are able to do so. So we urge everyone who has not received the vaccine to make sure that they get one and go to one of our vaccination sites. We're doing everything we can to make sure that you can just walk up and get your vaccine. Also want to acknowledge that today is also National Nurses Day, and I want to thank everyone who's been on the front lines, especially our county nurses, for their dedication during these very difficult times. Thank you for the hard work and everything that you've done on behalf of our county. Muchísimas gracias al presidente Fletcher por su información. Quiero iniciar esta tarde con un agradecimiento a todo nuestro equipo y organizaciones de nuestra comunidad que continúan trabajando en esta importante labor. Actualmente, el condado continúa implementando nuevas estrategias para asegurar que lleguemos a las metas de vacunación que fueron establecidas en nuestro plan. Es por eso que tenemos que continuar evolucionando esta situación y ahora nos estamos enfocando en hacer llegar las vacunas a aquellos lugares donde no ha habido todavía mucho acceso. Es importante recalcar que se han logrado algunas metas y es evidente que los programas han funcionado. En la región sur del condado tenemos más ya del 61.9% de la comunidad que ya está vacunada por lo menos con una vacuna. Y pues lo que hemos hecho durante los más altos de la pandemia el objetivo era que las personas tuvieran acceso a la vacuna. De los 39 códigos postales más impactados por la pandemia, ya llegamos a cifras que superan el 50% de vacunación, por lo menos con una dosis. Inclusive algunos de los códigos postales ya se encuentran con el 60% de sus habitantes con al menos una vacuna, y eso es una muy, muy buena noticia. En cuanto a las otras comunidades, vamos a seguir haciendo todo lo posible para que existan más oportunidades. Como mencionó Chair Fletcher, va a haber, ya las vacunas van a estar, los cientos de las vacunas no solamente van a poder llegar sin cita previa, pero también van a estar abiertos hasta las 8 de la noche en algunos casos para aquellas personas y los trabajadores que tengan que llegar, que no puedan ir durante la mañana, ¿no? Entonces, vamos a seguir haciendo intervenciones para que puedan tener acceso a las comunidades a sus vacunas. Así que ya estamos muy cerca de nuestra meta y debemos seguir trabajando juntos para lograr nuestros objetivos. Hoy también es el Día Nacional de las Enfermeras, entonces quiero agradecer a todas las enfermeras del Condado de San Diego por todo su trabajo que han hecho para mantener a sus comunidades seguras. Gracias.
Thank you, Vice Chair Vargas. We'll now go to our call-in questions.
We have one call-in question from Kristen Takeda with the San Diego Union Tribune.
Hi, I have a question and a follow-up question about vaccines for students in schools. The question is, can public or private K-12 schools require COVID vaccines for in-person attendance?
I will have Dr. Wooten address that.
I understood the question, can the county require schools to vaccinate?
Can schools require vaccines?
It would be up to each of the various districts to make that requirement, and then their board of directors would have to vote on that. So it could potentially vary from school to school.
Thank you.
Okay.
Okay, and then, I just had one follow-up to that. I noticed that it looks like about 30% of youth 16 to 19 years old have been vaccinated so far. I was just wondering, does that number seem low to you? And if so, why do you think it's low, and how should schools or parents respond?
Well, actually, that number is quite encouraging, as given the fact that we only opened up for everyone 16 years of age and older to be vaccinated on the 15th of April. So in just under a month, we have that number, and I think that's an encouraging number, and we will continue to focus on vaccinating all of the age groups, but particularly those that have the lowest vaccination rate. Thank you.
Okay, thank you.
All right, let's go to our texting questions.
This first text question is from Marilyn Heider with Kogo News. Do the daily case testing numbers include students and employees of businesses who get tested on a regular basis?
Yeah, thank you for the question. The daily testing numbers include every PCR test that is done. A lot of entities that are doing their own testing often use antigen or rapid tests. Those numbers are not included. We have never included antigen or the rapid test throughout the duration of this. If they do get a positive with one of those, they always seek to verify that with a PCR test, and that is included in our total. So it just depends on what type of test they're doing. But our daily totals include all PCR tests, but do not include antigen tests.
This next text question is from Madison Sinclair with KOSI. San Francisco and LA moved into the yellow tier on Tuesday. How close is San Diego to moving to the yellow tier, and what do we need to do to get there?
Well, to move to the yellow tier, we would need 2 consecutive weeks of case rate in the yellow tier metric. I will note that San Diego has a lower overall COVID case rate than Los Angeles does throughout the duration. They had significant spikes where more of their folks, significantly more of them, were infected, which lowers the probability those folks would get it now. So we would have to have 2 consecutive weeks in the yellow tier. I'm not overly optimistic that will happen before we get to June 15th. Which is just over a month away, which is the retiring of all of the colored tiers. But we'll have to monitor and see how we're going. We obviously descended this week. We're lower this week than we were last week. So we'll continue to assess it as we move forward.
I think Dr. Wooten has a comment.
Dr. Wooten, yeah.
I would like to point out that Los Angeles and San Francisco have a higher testing percentage. And that can help decrease the case rate to a lower level. So that is one reason why San Diego has a lower case rate, because of the increased amount of testing that they're doing throughout the county, in schools, and probably even in colleges. Thank you.
All right, next text question.
This next text question is from Jonathan Wozen with the Union Tribune. Given that the VA and Department of Defense numbers are now included in the vaccine dashboard numbers, does the dashboard reflect the total numbers of vaccinated San Diegans? If not, what data is missing, and will less vaccine be routed to superstations as part of the pivot to smaller pop-up clinics?
Yeah, thank you, Jonathan, for that question. The VA and the DOD were the 2 largest entities missing from a complete picture of where we are in San Diego County. We don't get federal detention facilities or prison data. Maybe we will as we move forward, but it's probably a relatively small number. So I can't tell you that this is absolutely every single dose that's been administered to a San Diego County resident, but it is awfully close in terms of getting there. So we feel much better. The data paints a much more holistic picture, but there are a couple little entities out there that we're still trying to round up, but I don't think that those would have any significant impact in terms of the general trajectory or overall where we are. In terms of doses being routed, we're in a situation now where we have more doses than we have demands for appointments, and so I think we're going to be able to stand up some of these expanded hours and pop-up locations and other types of things without compromising the integrity of making sure that places that have appointments get those doses. If one location is really filling all of their appointments and they think they could do more, it would be easy enough to reroute more to them. And so we're in a very different situation where I think we could fulfill any individual site's need to meet the demand by moving vaccines to them. So I think we're in a very strong position that way.
This next question is from Kim Miller with ABC 10 News. The county previously stated a slowdown in the number of people being tested was the reason we lagged behind Los Angeles County in moving to the yellow tier. At what point will the state or the county recognize that the increase in vaccinations may be the reason fewer people are going to get tested, or that people just don't find it as necessary anymore, given that some experts are predicting the state will reach herd immunity next month?
Well, I think we recognize that. I mean, look, we are far ahead of Los Angeles in the number of folks vaccinated. 63% of all eligible population have got at least their first dose. That is significantly ahead of LA. And look, just in general, we're better than LA. We're a better place to live. Our traffic is less bad. Our baseball team is better. You can check the standings. We took 3 out of the 4 last time. And our overall COVID case rate is lower than LA. So I don't really care. You know, they got all their cases out of the way in a huge spike that was really awful, and now they have fewer people to get it. So they may be a little bit ahead of us in case rate at the moment, but San Diego's still better. So I'm not that worried about LA.
This next question is from Richard Allen with CBS News 8. Are there any updates on the number of COVID cases in San Diego County in which the variant that was first detected in India has been found? Have there been any additional cases besides the woman in her 20s who had traveled to India in March?
Yeah, Dr. Shah will answer that for you.
Good afternoon, and thank you for that question. Other than the information that was previously announced by Dr. Wooten, we've had the one case of the B1617, also known as the variant of interest, that was first identified in India. Again, this was a woman in her 20s that returned from India, was briefly hospitalized, and then subsequently whole genome sequenced. We have not had any additional cases. Thank you.
Thank you, Dr. Shah. Next one.
For text questions for today.
What's that?
This is it for text message questions for today.
That's it. All right. Thank you all for tuning in. We will keep you posted. And again, tomorrow we should. I think tomorrow morning we'll put out some more information around pop-up sites and partnerships with businesses and others. So thank you all. We will see you next week.